Thank you, ladies and gentlemen. We are glad and honored to have you here as we welcome you to the Smart Kenya Healthcare Providers Forum. Ladies and gentlemen, this is a landmark event where innovation meets healthcare excellence. It's a forum that serves also as a vital platform to bring together the healthcare providers, the thought leaders, the innovators, and also the key stakeholders, all united by a shared vision, transforming the healthcare landscape through collaboration and also the solutions. Ladies and gentlemen, we are looking forward to today where we shall dwell in the critical conversations and also explore the groundbreaking ideas aimed at addressing the unique challenges and also opportunities within the healthcare sector in Kenya and also beyond. As we embark in this journey, ladies and gentlemen, I encourage you to remain and also be inspired, engaged, and also empowered to create a future where healthcare is smarter, more accessible, and also truly transformative. Thank you, ladies and gentlemen, and let's make this forum impactful and memorable. My name is Ian Mwerore. I am going to be your MC for this particular event. It's a privilege and an honor to be associated with you all. We want to go to the first part of the program, ladies and gentlemen, that is on the opening remarks. To give us the opening remarks, ladies and gentlemen, is a lady that I've come to admire her leadership and also the way she's been able to grow a team and also achieve remarkable milestones in enhancing operational efficiency, patient experience, and also overall healthcare outcomes. Through her exceptional leadership, ladies and gentlemen, she's had a great understanding of the healthcare service providers. Her approach definitely ensures that they're all informed, and also she is up to the task of transformative technologies at disposal. Ladies and gentlemen, she has been instrumental in leading the hospital operations division, overseeing the strategic initiatives, and also integrating the cutting-edge technologies with patient care. She is the Group Director, Healthcare Business at Smart Applications. Ladies and gentlemen, help me welcome Esther Masharia as she comes forward to give us her remarks. Welcome, Esther, and we appreciate your leadership. And as we say in Swahili, karibu sana.
Thank you so much, Ian. Good morning, everyone. Good morning once again. Are we not happy? See, we are happy. So my name is Esther Masharia. I head hospital operations, and therefore today I am your host. And I am really so happy that you agreed to join us for this forum. This is our final forum for the year. We hold these forums in different regions. We have been to Nakuru, we've been to Mombasa, and we're ending the year in Nairobi. So for me, to really say, I want to take this opportunity to sincerely say thank you to each one of you for joining us today. Your presence makes this day a truly exceptional. And it's a reflection of how partnership that has flourished between Smart and all our providers over the years. We've walked this journey together for the past 21 years, and through your invariable collaboration, Smart has grown beyond the borders. Today, the Smart solution is operational in over 11 countries, and we are serving over 8,000 healthcare service providers across the countries where we are present. This achievement would not have been possible without your unwavering support, collaboration, and shared commitment to excellence. In line with our promise to continually innovate and enhance customer experience, Smart remains steadfast in delivering forward-thinking, patient-centered innovations, many of which we are excited to present to you this morning. Thank you all once again for being part of this journey and for making this day extraordinary. So for me, it's to say karibuni sana, and yeah, let's see what we have for the day. Thank you.
Thank you, Esther Masharia. Let's appreciate her one more time. We appreciate your leadership, and we appreciate everything that you do at this organization, and that also touches the hearts of many people out here. All right, fantastic. Ladies and gentlemen, we're looking forward to a fantastic program today. We also have a panel discussion that is going to be quite engaging. We have a keynote speaker who's going to speak to us. We'll also have demo sessions. We'll have a soft launch so that we can better appreciate the value proposition that is being forwarded by Smart Applications International. Let me see by a show of hands how many can say, I am proud to be associated with Smart Applications International. Proud. And as you take your hand forward down, please give a high five to the person sitting next to you and tell them, I am smart. I am smart. Proud to be associated with such a phenomenal and strong, wonderful brand. I have been following the organization closely, and I can tell you they have been a trailblazer in this market, and we appreciate the fantastic work that they are doing here. Now, ladies and gentlemen, we want to get to a moment where we can be able to hear from our keynote speaker. And ladies and gentlemen, he is a man with a career that has been defined by visionary leadership and also relentless, and I say that with a lot of pride, pursuit of excellence. And he has been instrumental in making sure that the smart technologies across multiple industries are making impactful strides in healthcare and also beyond. One of the things that I have also seen closely under his guidance, ladies and gentlemen, Smart Applications International has definitely become a trailblazer in delivering cutting-edge solutions, efficiency, and also, most importantly, ladies and gentlemen, transforming lives. His passion for innovation, coupled with dedication of driving growth and excellence, has made him a respected figure in this particular business world and beyond. It is my distinct honor, ladies and gentlemen, to introduce an extraordinary leader in the field of technology and innovations. And he is a strategist par excellence. Please help me appreciate on stage the Group Managing Director at Smart Applications International Limited, Mr. Harrison Murillo, as he comes to give us his keynote. Makofi tafadhali as we welcome him. Thank you for being a phenomenal leader in this area and beyond. Thank you.
Thank you very much, Ian. Whenever Ian does an introduction, I always wonder where he gets such marvelous words to describe anybody. So good morning, everybody. Good morning once again, ladies and gentlemen. Indeed, as we stand here, the first and foremost thing we must say is thank you. Thank you so much for taking time off your busy schedules today, distinguished guests that we have here, ladies and gentlemen, from the healthcare provider segment, from the insurance segment, and different stakeholders. If it were not for you, this humble vision, and I dare say humble vision that we had 21 years ago, would not be the great brand that it is. We have stood in the shoulders of giants who are represented here. Indeed, if I was to mention each and every one of your names, it will take us actually half of the day. And therefore, feel special, feel recognized, feel at home, because Smart is a brand that has been built in Africa for the world, and has not been built in isolation. It has been built because you accepted 21 years ago to dare to dream with us, to welcome us in a new concept that had not been done anywhere else within the boundaries of the continent of Africa, to hear our story and to dare to try to be different. And that's what we have achieved today. Ladies and gentlemen, as I stand here, we want to gather under the theme of empowering healthcare access through patient-centered care, and I dare say digitally. When you look at the graphics that we have across the room, we see a doctor, and who else do we see? A number of us might say Tony Starks from Avengers, right? It's because we're living in a world which has become digital in every sphere. When I look across the room, everybody has a phone. Everybody has interacted in one area or other of life with the AI. And therefore, we are coming to terms to the fact that we must be digital first in everything that we do. We must integrate the aspects of digital. But how do we, as healthcare providers, as healthcare stakeholders, bring that to the fore, yet we are indeed very much kept busy with aspects of clinical care, of operational aspects of our institutions, of financial aspects of our institutions, all that demand our attention. It is through partnerships and collaboration. And that's the testament that we stand here today to say that if we are to transform the landscape of Kenya, we must empower healthcare access through focusing on the patient digitally. 20 years ago, we started our journey. A couple of friends met somewhere and decided that they would not wait to see another insurance fold up, that they would not wait to see another hospital bear the burden of financial loss because of fraud and inefficiency. And we started our concepts then by being the first entity to introduce fingerprint identification. And for those of us who recall our first minimum viable product, if I dare say, call it that way, the fingerprint was separate. There was a card that you had to place before you registered the fingerprint. You'd probably have to make 5 calls to smart applications before you registered the patient. And then you had to walk through the motions of opening a different application to do the benefits, and then another third application to do the claims. Through your unwavering partnership across those 21 years, we have achieved something that has not been achieved anywhere in the world. One of the things that we were able to do collaboratively with you was to gain acceptance. And today, my heart bears gratitude for the first 30 hospitals that are accepted us. A number of you I see in the room today. And I remember those days we used to come with a big box that looked very much like this podium I am on, and we would place it with a computer, and we would train one person whom, if they were not available, then all hell would break loose in terms of patient care. Today, we are able to say that from that first 30, from that first 4 medical insurers and scheme administrators who believed in us, some of whom I see in the room as well and recognized you especially, we rose to our first 100 hospitals by 2008. In 2011, we were able to go beyond the boundaries of Kenya into Uganda as our first regional market. We hit the 1,000 mark of providers by 2012. We were able to venture into other regional countries in 2012, namely South Sudan and Rwanda. And in 2014, we had combined our solution into one single interface seamlessly that also incorporated new features like e-claims. In 2016, we began our diversification journey, incorporating our biometric identification extension into staff clocking in and clocking out, what is known as time and attendance. And I'm today happy to say there are notable names like Aga Khan and Nairobi Hospital who are using this solution within their facilities for shift management. Then, boom, 2020, COVID comes, and it disrupted all of us. And we had to, again, change a little bit of our trajectory then to accommodate the new world that we saw ourselves in. And that saw us introduce the one-time PIN. Again, through your collaboration, through your suggestions, we were able to swiftly roll it out to the market, and we were able to go through the motions of that very daunting period in the face of humanity. In 2022, we made another bold step. We did away with the smart card and introduced virtual access, a feat that we could not have done without your collaboration and support. A number of you I see here, I know we personally had conversations together as you engaged patients, because we could not reach each and every patient, and some of them learned of virtual access right at the point of care. Again, we say asante sana to each and every one of you for bearing with us and walking that journey with us. In 2022-23, towards the end, we introduced our hospital management information system offering. And today we are proud that 115 healthcare facilities within Kenya have adopted this solution, and we continue to add value in this regard. As we stand today here, this December 2024, we are looking at 5,213 healthcare facilities who are using the smart system each and every day we work together with you to ensure that 18,640 patients receive care. Let's clap for ourselves. That means, as you sat here, and as you sit here, every minute, 12 patients are getting access to healthcare services through our mutual collaboration. Indeed, this is something that many countries across the world have not achieved, including developed ones, in terms of their digitization efforts across their healthcare systems. So this year, as we sit here, we are looking at how do we move forward. And how we move forward calls for deeper interconnectedness between all the stakeholders within the healthcare value chain. It calls for us to sit, share knowledge, and have conversation on how we can, as a healthcare industry, move forward. Across the last 5 or so months, we have been thrown into, especially within the boundaries of Kenya, new shifts, if I call it that way, within the healthcare ecosystem. New regulatory frameworks have been put in place. We talked about Chief Shah, yesterday it was Taifa Care. I will not delve into that any further. But these are things that are happening even as we take care of the holistic 54 million Kenyans who depend on us. Why do we congregate? We congregate because through these provider forums, we don't only share with you our new offerings, but we also very much take time to listen to you, to listen to your needs, to listen to your challenges, to understand what is going on in your respective healthcare facilities, and to reflect on our commitment to you as our partners towards this mutual shared vision of making the patient access care conveniently, with ease, but also to make our institutions be able to be sustainable and resilient on the backdrop of these changes that are happening across us. Kenya has made great strides in healthcare, but barriers remain. Shortfall in healthcare financing, inadequacy in doctor-to-patient ratios, long wait times, pressures on the healthcare infrastructure, inadequate data or fragmented data to make decision making, legacy systems that we have and legacy frameworks that we use in operations, and that lack of insight and timely decision making to address these inefficiencies. As SMART, we look at the glass as half full, and we take these challenges in stride as opportunities to innovate, to leverage technology to drive meaningful change. Our solutions, starting with the MediSmart solution, which is our flagship product that interconnects payers to providers, patients to hospitals, hospitals to payers, is currently a testament of how we can use technology to streamline operations and improve lives. Additionally, through our Smart Health Hospital Management Information System, we have seen remarkable uptake across the region, with now driving towards the 200 hospital mark, our largest footprint being in AIC Liten, and we celebrate that team specifically for taking the challenge to be our first level 5 hospital on this platform. It is an amazing flat platform that is feature rich and which we shall be showcasing today. And we hope that we shall convert a number of you towards this new offering that is rich on workflow automation, resource allocation, digitization within your hospital operations, digital patient management, making it a holistic way to transform your healthcare facility. Your contributions through feedback on all our platforms help us to optimize these solutions towards realizing impact for the patient. Together, we continue to redefine what is possible in healthcare management through innovation. In 2024 particularly, we have remained steadfast in optimizing our solutions to reduce the wait times, to ensure that we have better system reliability, enhanced workflows, and digitization. One of the things that we were able to roll out with your collaboration has been pre-authorization, which we introduced this year, digital pre-authorization that is, and to drive towards lower cost of care through enabling the visibility that is required between payers and provider to increase efficiency around processing of claims, and therefore driving towards how we can contribute towards improved revenue assurance for sustainability and growth of our healthcare system. As we move forward, we again, just as we did back when we went through COVID together, as we transformed from a card-based platform to a virtual access platform, we come again to you this morning. We anchor ourselves on the principle of a human-centric approach. Our commitment is to place you and the patient at the very heart of our solutions, because with that, then we drive digitization that is relevant and that empowers and that wows our end customers. We once again ask for your collaboration and steadfastness as we move forward. There is an exciting journey that is ahead of us. For a long, long time, we have been like the proverbial Toyota. How many of us drive Toyotas today? Constantly improving, reliable, dependable, functional, never failing, and when we fail, we bounce back quite swiftly. They say that you can even buy Toyota parts at the supermarket and continue your journey. I don't know how that true is. But just like in the case of Toyota, a number of people say that Toyota does not look too good, that it is functional but not modern. We have heard you, and just like Toyota, as you have seen in the 2023-24 releases, we have gone ahead to combine functional features with modern design. So to all our stakeholders today, especially you at the point of care, who have requested for us to advance with a modern web interface, guided workflow-based systems that are more intuitive, that make your work easier, that let you focus more on the patient than the system, that is more appealing, that makes you, when you walk and use a smart system, to face it with a smile, that combines our various smart solution offerings and provider tools into a single access interface, and that lays the foundation for modern integration as requested by our IT counterparts at the healthcare facilities, and that delivers digital engagement as a foundation for the next level of patient communication, claims analysis and reconciliation, and interfacility communication. We are glad that as we stand here, we shall be showcasing that answer to that question that you have asked us for many years. We shall be introducing to you our revolutionary SmartLink system. I repeat, we shall be introducing to you our revolutionary SmartLink Pro system that will take us to the next level of excellence, and that we shall be rolling out in 2025. This comes as a testament to our commitment to listening to your feedback to working together towards achieving better efficiency. And as we do that, we know that once again, we can count on your support to make our users happier, our patients better, and to strengthen our partnership for a better, affordable, and enhanced quality healthcare outcomes. Together, by moving forward as we are pronouncing today, we can create a future where seamless patient-centered care is a standard across Kenya and beyond. And others can come and study and benchmark what we have done for this nation that has transformed healthcare. Again, I reiterate a statement that I said earlier as I started this discussion. Let us be the example built in Africa for the world. We thank you for your cooperation, your trust, and your dedication to making healthcare more accessible and impactful. We continue to be at your service as SMART, constantly improving in line with your feedback to us. Therefore, we look forward to your conversations. Each of you is highly important to us. We have set out booths, and during the breakout sessions that we shall have, our teas, coffees, please reach out to a SMART person, my great colleagues who are across the room and outside, and ask, what's new, what's next? And we shall definitely answer that question to you. Feel free to ask us, what can we do together to solve the challenges that we are facing at our respective institutions? And we shall be more than happy to give you an answer or to walk the journey towards getting an answer to that solution. Let the discussions be the next elevation of our mutual journey towards success. As we come to this period where we are ushering December in the next 8 days, I also want to take this opportunity to wish you all and your loved ones a blessed festive season. And again, as we start this conversation, I take this opportunity to tell you, karibuni sana to this Smart Provider Forum, and asanteni. Thank you.
Thank you very much to our keynote speaker, Group Managing Director at Smart Applications International Limited, Mr. Harrison Muiru. Let's appreciate him one more time with a round of applause. I love what you said about, yes, definitely people coming to benchmark with us, built in Africa for the world. And I'm confident that when we partner with Smart Applications, we can be able to go from one level to another level. Ladies and gentlemen, I just want to kindly request if we can all rise to our feet for just 1 minute. If we can all rise to our feet. Something phenomenal happens when you partner with Smart. You get a certain traction in this particular market. You get a certain movement in the market. What I want you to do, I want you to just move your knees forward and back, forward and back. It'll give you a bit of a bounce, forward and back, forward and back. So when the left one goes forward, the right one goes back. They interchange like that. Fantastic. Now I want your shoulders to get also there, like you're charging at someone who has been with your PO for 6 months. They haven't come through, all right? This is how we're charging with the market, with the digital transformation that is happening here. We are going to charge at the market like this. And then put your fingers here. And then I want you to click your fingers. Nice. Together as one team for Africa, by Africa to the world. And then in 3, 2, 1, you take it down and up. Down and up. Down and up. Fantastic. The other thing that is going to happen, ladies and gentlemen, your phone won't stop ringing. All right? So I just want you to take out your hand like this. This is the pinky finger and your thumb. That is your phone. All right? You put it down and up. To innovation and up. To efficiency and up. To better customer service and up. And make sure your facial expression is okay because we are live. All right? Down and up. Ladies and gentlemen, finally, when we partner together, we move from one level to another level. And how we are going to do that? With both hands, we take it from the bottom like this. And we bring it up. Hold it there from the bottom. And bring it up. One more time from the bottom. And bring it up. We usually say at SMART that this is best done with music. Mr. Director, give me that song. Very much. Ladies and gentlemen, the next part of the discussion, new innovation in healthcare access. We want to have a better understanding of what is in store. And at particular this point in time, ladies and gentlemen, I'd like to call back on stage a Group Director, Healthcare Business at SMART Applications International. Ladies and gentlemen, let's appreciate one more time Esther Masharia as she comes forward to guide us on this particular conversation, the new innovation in healthcare access. Welcome, Esther.
Good morning once again. And thanks, Ian, for the music. I was feeling the room is a bit dull. Are you guys not happy being here? So, like our group managing director here, my boss said, we have worked through for 21 years. And you have been our pillar of support. I remember when we started off, our first provider where we set SMART was actually Nairobi Hospital. And they partnered with us. They were the first. They were very patient with us. We moved on, and now we are at 8,000 providers. When we could not even afford to have a panel or a forum like this, you soldiered on with us. And what we've done for our hospital is that we have grown our product by listening to you. A lot of the feedback, how we have enhanced our system, has actually been guided by what the hospital has told us, what is good for the patient. And we have a very good vision going forward. And this vision is on patient-centered care. We want to make sure that you're not worried about papers. You're not worried about did the patient come, queues. We want to manage those things for you so that you can concentrate on offering, treating people. You don't have to worry about did I get paid. So we want to bring a lot of transparency, a lot of empowerment for the patient. And therefore, I will just touch briefly on where we're coming from when we started off. We had a desktop application, a system where we come, install it for you. We have different softwares, and it's a standard blue icon that you have to open the screen, click on it, and then you have the system. That is the system we have used for the last 21 years. The system has worked very well. And there was a reason why it worked, because even technology had not been enhanced, because our system does not only work in Nairobi, we have providers in Northeastern where it is a bit difficult to have online connectivity, the previous years. So our desktop application enabled us to achieve both online and offline functionality, because the patient does not care if there is a connectivity, the patient does not care if there is internet, they just want to come and get served and go home. So the reason why I had that desktop application was important is because we wanted to make sure that the system is available anytime the patient is there. We enhanced that through different asks. We had a few multiple deconsolidated systems, because you had a system for billing, you have another one for reporting, you have another system for EDI where you do claim submission, and it's quite cumbersome. So you to have 3 systems from one organization. So this is where we are coming from. A desktop application, those people who are techies like us, it has its own limitations, because we have wanted to have enhancement, bring in pre-auth here, bring in inpatient, outpatient pre-auth, be able to do referrals. And at some point, a desktop application is a bit limiting for you to be able to achieve what you want. However, we expanded our footprint from one provider to 8,000 and over 10,000 touch points. These are people who interact with our system every day, because we don't install smart at a single point. You look at it at Aga Khan, probably we have about 100 touch points across a hospital. Nairobi Hospital will be close to 50. And even the small clinics, we have more than one installed points, because we want to make sure that the patient is not struggling to go where the smart system is. And of course, with over 20,000 daily interaction, different people, different patients who seek services through the smart platform. And we've been able to transmit over $500 million every day through the smart system. And that journey now, in our forward-thinking vision, has brought us into what we're going to be discussing today, our future for healthcare service providers. And we're glad to be introducing the new frontier, our new system, a healthcare service platform that aims at consolidating all the provider services into a single integrated solution. And what we're looking at here is enhancing patient experience through AI-powered billing. So our new system will be SmartLink Pro. So you'll no longer be seeing that blue icon on the desktop. And now this will be the new face of Smart at your point of service. Come 1st of January, we shall be up and running with our system, but today we're going to show you the functionality. And what we're saying is that we're keeping the patient in the middle of this system. So the features that we have on our SmartLink Pro system is going to be a web-based platform. So, the way my team going around 5,000 providers, and when we are doing an upgrade, probably to take us a month to finish up. So our web-based platform will make sure that if we have an upgrade within the day, when you wake up in the morning, you will see a new features on Smart, and you'll be able to actually use that within very limited time. The system is, of course, going to be supporting both virtual and card billing, because when we migrated to virtual, it's not everybody who has been able to let go of the card. There's people who still feel I need to carry this physical card. I'm not sure why, but as we migrate to virtual, the system will have capability to bill both virtual and card patient, those who would card with the card. Our new system will be able to do fully outpatient and inpatient pre-authorization. This has been a conversation, because now we have a system that is no longer remitting. And part of what we'll be showing you today is that we will have both outpatient and inpatient pre-auth on that platform. We have also enhanced our EDI offering. We're not going to have another standalone EDI system, that when you bid on this system, you open another system to submit claims. No. Everything will be happening on a single platform. And that system is also going to be introducing an interaction component for efficient support and feedback. We are going to have a chat capability on that system so that when the users are using the system, if they're not able to call us, they will be able to engage with us on an instant feedback chat capability that will be on our system. We are requesting for a lot of feedback because when we go live, of course, we expect a lot of feedback on enhancement and the things that we can improve on. So another feature that is going to be on our system, of course, facilitated by our Smart Access virtual product, the app, we are going to be incorporating a patient engagement and telehealth capability on that system, where the patient will be able to do their online booking. If they want an appointment and you are on our SmartLink Pro platform, you will be able to use that through our Smart Access app to book an appointment and also to have a virtual consultation if the hospital will have taken the telehealth product. Another key feature that is going to be on that system is on the referral and e-request management, where if I come and see a doctor, my gynecologist, and I'm given a prescription, I need to take medication probably from a pharmacy, I don't have to carry the physical prescription with me. The system will have an e-referral component and an e-prescription component, where you can be able to log into the system, select the preferred pharmacy, select the preferred, probably if it's an X-ray center, and you'll be able to submit that e-prescription on the system, and the different, and the intended pharmacy or the intended provider would be able to see that. And what we are saying is, if you don't need to go to the pharmacy to be able to pick drugs, they can have that delivered to you, but on the system, they will have that information. We're not going to have a lot of data inside, because what we're going to do on this system, we shall be onboarding all our healthcare providers afresh. We will have a fresh registration. We will also give you a platform where you can be able to publish your service catalog, because our product powered by Smart Virtual Access has a geo-tagging component, where if a patient is looking for a dentist near them, you'll be able to find them on the SmartLink Pro platform. So we shall also allow you to publish your service catalog, because if a patient is looking for a physician of whichever service, they should be able to find the one that is near them, and want to make sure that your services are available for whoever is looking for them. So what we're saying, we are going to be giving a lot of visibility to providers, also to enhance your business development, because the more the patient is able to see you as a provider, the more footing you get into the facility. So what value is this system going to bring for healthcare providers? When we are talking about, we're going to have a lot of process optimization. We said we are doing online pre-auth. We're going to enhance our EDI capability. This time it's not going to be, you are just submitting. There will be a feedback loop after the payment and processing, so that you can have information on how your claim status sits. We're also going to have a doctor's module, because when we went live with pre-auth, one of the key components we need is the diagnosis. And some providers were saying diagnosis is only captured by the doctor. So we are going to have a doctor's module, a module that is only going to be available for the doctor to enter the clinical information for the patient. We're also going to be giving a lot of value on cost management, because the entire process now will be paperless. So you no longer need to submit PayPal. Okay, you're not even submitting them now if you're not Smart EDI. So that is also an enhanced process. What I talked about is that the product will also have a capability for patient to self-register. Because every time I go to the hospital, I go to Nairobi Hospital, I'm given a paper to fill my bio details. It's just a standard form. So what we've done, we've automated that form. So the registration process for the patient is no longer going to be manual. So if you opt to adopt our self-registration form, the patient will be able to do that on the app, enter their details, and when they submit, you would actually have a patient who is queued in waiting to probably go and do triaging. So you're eliminating a lot of the time they take to register patient because they are coming to fill in a physical paper. Of course, I talked about business development. We're going to enable you to increase your visibility and let the patients who are on the smart platform be able to find you through our smart virtual access app. Of course, what we said is that the system is very much AI enabled. So when you're billing, if a certain service probably is not allowed to be billed, the system will automatically give an alert to the user that this is going to be a possible rejection should you continue billing that service. So making sure that we are reducing your claim rejection rate even a little bit more. Of course, there's also a payment tracking option where you will have visibility to the claim journey. You will be able to know the claims that you've submitted to OM. I'll use OM because Dr. Maharo is sitting here. You will have visibility to see how many have been processed, how many are partially paid, and working together with different payer, we are also hoping they would give us that feedback loop so that that feasibility can be given to the providers. Of course, we're going to also be allowing information sharing. I said you will have referral management on the SmartLink Pro system, a lot of data insights. Because remember what I talked about, we'll be having a fresh registration for all users. Our previous system, you did not need to register as a user when you use it. But the new system, every user will be required to have a registration. So you'll be able to track what users capture the same diagnosis regardless of what ailment. Because part of what we see with the data coming from the hospital is they somehow tend to pick the first diagnosis. Everything is abnormal, I don't know what. So we make sure that you can be able to know what your users are doing on that system, and then you can enhance efficiency. So for the patients, what our new solution will do, the patient will be able to locate a provider via smart, based on different features, capability on speciality, and the services offered. Maybe we'll enhance it to the quality of care, because we want in future to have the star rating capability after the patient has been seen. Can they say or give you feedback on how services was at that hospital? So there's a lot of convenience for the patient. There will be the self-registration capability, online appointment booking, and telemedicine, where the hospital has actually taken that capability on the SmartLink Pro. We have a lot of patient empowerment. We're saying now you can have referrals. You can also have access to the queue. If you're going to seek services at Avenue, you will, if you're on the SmartLink Pro platform, you'll be able to manage and see how the queue is, so that you're not going to the hospital to be waited. There's also going to be a lot of information on services offered. Not, of course, if you've done, you go to the lab for a lab service, most of the time you find out if you have to go and keep asking, are my results out? So what we'll do, we have a notification capability on our system. It's going to give you an alert when your services are ready. And we're not going to say we'll be disclosing the results, not just alerting the patient that your lab results are ready, proceed probably to the next for review. Of course, we're going to be enabling the patient to have access to their medical record. And of course, they will have a lot of information on their medical cover and utilization. So we're going to be empowering the patient so that they are not coming to the hospital when their cover is probably running out and they are not aware. So with that, I'm happy to say that we have a new product, and my request is we shall come starting 1st of January. Please open the door for us. We do that upgrade, and we soldier on together. Thank you so much, Ian.
Thank you for that, Esther Macharia. We appreciate you guiding us through the value proposition, and definitely we are looking forward to January next year. Please let's appreciate Esther one more time with a round of applause. Fantastic. when Esther comes and guides us on the value proposition, it is also very important for us to also have a very good understanding of the SmartLink Pro. And our next point of the discussion will be a systems demo of SmartLink Pro, so that now we can be able just to appreciate the value proposition. But before I do that, I just wanted to check in with the room. Did we all receive vouchers as we were coming in? Let me just see by a show of hands if you received any vouchers. Our team is going to give out vouchers because we have quite a number of giveaways that we need to give out this particular morning. Quite a number. And we appreciate our partners who definitely made that possible. So our team at Smart will make sure that we can all have the vouchers, and then we'll be able to engage each other and also celebrate the many, many gifts and the many winners that we're going to get out of the room. So ladies and gentlemen, we want to go to the system demo of the SmartLink Pro. And to guide us in this particular discussion, ladies and gentlemen, he brings definitely a wealth of experience and expertise in product development. Bear witness of his demos and his expertise on the same, and having successfully launched also cutting-edge solutions that meet the market demands. But one of the things that stands out about him is that he possesses a unique blend of technical prowess and also business acumen, making him an invaluable player within the organization. He's a product manager at Smart Applications International. Ladies and gentlemen, help me appreciate Mr. Isaac Mushiri as he comes to guide us on the demo. We appreciate your technical expertise, and we look forward to this particular conversation. Welcome, Isaac Mushiri, and over to you. Asante sana.
Thank you. Thank you, Ian. So, good morning, everyone. Good morning. Yes. So, thank you, Ian, for that very serious introduction. As Harrison said, sometimes you introduce someone and we wonder if that is you. But thank you very much. So, good morning, ladies and gentlemen. As has been introduced, my name is Isaac Mushiri from the Hospital Operations Department at Smart Application. And at Smart Application, I head innovation and product ideation, all the way from development to ideation to development and implementation for hospital solution. And it is an honor to stand before you this morning to unveil a very transformative and innovative solution that is set to redefine how hospitals like yourself and medical service providers operate and integrate with stakeholders. But before we delve into the world of SmartLink Pro, allow me to ask you one question. Have you ever heard of the saying that innovation is taking two things that already exist and putting them together in a new way? So that is exactly what we have done with SmartLink Pro. So we took the needs of the hospital providers, of the medical service providers like yourself, and the cutting edge technology that we provide as Smart in a truly remarkable way, and brought forth a solution that is going to redefine how you operate. So allow me to introduce and unveil SmartLink Pro. So this is not just a system. It is a solution. It is a platform to enable medical service providers streamline operations and ultimately enhance patient care. As Esther has introduced, this is a combination of the efforts that Smart has been able to take over and the medical service providers. We made this solution from workshops, from interactions with hospitals, and this is a solution for you. So how are we going to invite you to SmartLink Pro? once you have been onboarded by, let's take a pair, Old Mutual, we are going to invite you to the solution where we are going to register. For the first time in Smart Solutions, we have an onboarding process for medical service providers. So this is going to be invited through a link after you have been onboarded to provide medical services to insurance members. We have a very robust user management module. User management says that we are going to ensure that our users register. They are registered, and with a very robust approval processes, we are going to put in controls for the level of users you're going to have as a hospital. So that means if you have a front office user, we are going to allow them just to access front office services. That is billing, that is raising a pre-auth. If you have a back user, they are going to access finances, they are going to access reports, they are going to access. So basically we have put controls, user controls, to ensure that there is compliance with both data protection laws and also organizational policies. So that would mean that if a user in a hospital is not allowed to access the diagnosis, we are going to put controls over that. So this will be the registration window. So you can allow me to demo a registration. So these are the fields that we are going to ask you to fill. We have put controls around the passwords that you can put. Of course, strong passwords are going to be encouraged. We have put multi-factor authentications. So basically all systems securities that are needed, we have been able to input on the system, and your data is safe with us. So for the approvals, we will give admins in the hospitals. So you yourself, you will have an admin in the system who is going to approve users on your behalf. So these controls we have given to you as the hospitals because you are the ones who know who is going to access what services or what particular modules in the system. So after the member has been able to register and that user has been approved by the admin in that hospital, you will you will now log in and access the modules that you have assigned to access. So some of the modules will be billing, will be raising a pre-auth, will be accessing reports, will be capturing diagnosis. So depending on the that you have been assigned, those are the modules that you're going to access. As you can see, we also have protection around which data you can access. So as you can see, when I'm logging in, it's going to tell me that I'm logging in to access my provider. So it is a web-based system, but we have put controls around how you're going to access. These are controls around if you are a user assigned to a certain hospital, you can only access information that pertains that particular hospital. So allow me to log in with a user that had already been approved. So for protection purposes and also to enhance the data protection that we have on our system, a password is not going to be enough. We are also going to do what we call multi-factor authentication, and an OTP is going to be sent to either the email or the phone number that has been registered. So this is also to ensure system security. So upon login, this is where you will land. These are some of the features that Esther was speaking about. We have the SmartLink billing process, but now on a web platform. So these are some of the tried and tested functionalities that over the years we have been able to offer to you, but we are changing the mode that we are offering them. We are offering them on a web-based platform. So just a minute. Allow me to log in again. Okay, so on logging in, this will be the billing window. So if you are a front office user and you have been allowed to do billing, this will be your landing page. So for change management, we've been able to maintain as much processes as there are on the SmartLink system. So the first thing you're going to do is click the treatment type. If it's an inpatient or an outpatient bill, just as you do on the SmartLink. Then on clicking the treatment type, you will be able to search the member. We have introduced a workflow that is going to guide you from which step you are on during that billing process. So we are starting by searching the member. You can search the member using the various methods that we've always done. You can do with a card. As Esther has explained, there are still people who use cards. You can do virtual member. So for a virtual member, you can search either using a visit code. This is the code that the members are going to give you once they initiate their hospital visit on the Smart Access app. Again, you can search using other criteria, which is searching using the information that they're giving you. If they give you the member number, so you can search using either of these. If the information is available, you can search using the member number, ID number, member name, or member phone number. So for this demo, allow us to use the member number. So input the member number and click search. So it is going to give a result of the member, of the members, with a fuzzy search of the members who have a combination or that member number up somewhere in their phone number or in their member number, so that if you searched for that and there were dependents, they are going to show here. This information that is shown here is information that is compliant to data protection, so that you do not search for members without their consent. But for you to see any further information, we are going to select that member and verify. So this verification is as per the configuration of the member. If the member is a fingerprint member, like this one, they will verify using a fingerprint. They will present the fingerprint to you for that verification. If the member is configured to use OTP, the same will happen. So this particular validation process is biometric and very specific. You cannot search my information or have the results of my information before I actually biometrically validate that it is me. So as you can see, we have introduced a very beautiful card that can be co-branded depending on the insurance that the member is accessing services from. So this is a virtual card. This is the card that is on the Smart Access app. We have put it as a visibility for the medical service providers. We have also done an improvement of how the benefits are being showcased. So as you can see here, we have all the benefits for this particular member and the status of those benefits. So for you to bill, you'll now go to billing. And as I had explained earlier, you see we are giving you a very good workflow, telling you where you are in this whole process. So this is the intuitive billing window. When you call it intuitive, it is guiding you as you're doing the billing itself. So if you're billing an item that has a benefit rule applied to it, we are going to show it here. So, for example, let's just use, are just some of the benefits. So let's use outpatient frames. So as you can see here, this benefit is active and this is the balance. We are calling it a live balance because you're monitoring as you go. You won't be able to bill past the balance because you are displaying it to you during that billing process. So you can capture the diagnosis, the invoice number at this point. So this is how you will capture the invoice number. Then the diagnosis, we have put the capture diagnosis window here. You will be able to capture one or many diagnoses. We are going to integrate with ICD-10 and ICD-11. So you can search using either the ICD code or the diagnosis name. And you can do multiple diagnoses. So capture diagnosis, save the diagnosis. Then after you have captured the diagnosis and you now want to bill, we have retained the item groups and service items. So we can just use any here. Let's use lab for now. The frames, let's use consumables. Then we capture frames. So the executive frames. So this is what we are calling intuitive billing. Immediately you capture the item that you want to bill. It will tell you what are some of the rules that have been applied on these benefits. So you'll understand if there is a pre-auth, and the pre-auth limit will be indicated here. So by the time the member is being billed, you already know if you need to raise a pre-authorization or not. If the item is excluded, it will tell you that the item is excluded, and the risk of continuing to bill that item is an obvious rejection. So this actually is AI in action. We are telling you on the go, do you need to continue billing that item, or do you need to stop or seek for pre-authorization? So this is going to, of course, reduce the back and forth between you and the insurance. Already you will be knowing at the point of input if that is a possible rejection. So, sorry. Then you'll input your unit price, then add that item. You can add as many items as the benefit balance allows, and then save that claim. On saving that claim, the member, of course, will again validate or authenticate that bill using their preferred mode of identification. That could be outpatient, or that could be fingerprint or OTP. So this is something else that we have improved on the system. Initially, if you wanted to bill the same person for a second bill, you'll have to go search the member, read the card again. But we have introduced this particular billing confirmation pop. So if you want to bill the same member again, you'll just say yes. If you want to bill another member, it will say no. So I see Ian is standing. Just 2 minutes, then we finish. So allow me to showcase the pre-auth process. That item we have built does not require pre-auth. So as my colleague is coming, we're going to do it together. So you can now build an item that has pre-auth. So as you can see, you can again continue navigating with the benefit as you go. You can be able to navigate this. Also to mention is that this is non-integrated. This is capture claim. We also have advanced integration capabilities to existing HMIS. So if you have a hospital management system, we will integrate with it using very advanced APIs, and that information flow will be seamless and the process will stand. So finally, as we are saying about consolidated systems. Initially, after you had done billing, you needed to go to a different system to generate reports, right? So right now, if you have access, if you're allowed to generate these reports, this is where you will come to generate the reports. It is a web version of the reporting system that we have at providers, and this is how it will look. Of course, as I had mentioned earlier, this will be a right-based kind of a system. So if in a hospital, the people who are supposed to see this report are back office and finance office, they are the only ones you are going to allow access to this reporting. If an organization allows everyone to see this report, so this is how the reporting is going to be done. There is what we're calling a provider setup. Provider setup is where you're going to set up your profile. This is where you're going to upload your service catalog, upload the services that you offer, upload your departments, if you have any specialized clinics, you upload them here. So that on the member end, when they search you using the Smart Access app, they are going to see that this particular hospital is offering this service at this date. So this is where you're going to set up yourself. Again, we are giving that power to you. Right now, the setup is done on Smart side, but you are going to do it on your end. So allow me to welcome my colleague to showcase the pre-auth process, and thank you very much for your time.
Thank you, Isaac, for that. Okay. As I set up, my name is Fred Motari, so I'll be taking you through the IP billing process. So in the IP billing process, we've taken care of the patient from the time he initiates the visit all the way to the time that they're going to be discharged. So on the first landing page, what you can see on my screen, all the visits that the provider has created. So you have all the appointments, all the active visits, all the discharge requests on one singular page. So you'll be able to have everything visible on one single page. And again, on the left side, you're able to export the reports from that same page, and also filter using different statuses. Like if you wanted to check on all active visits, you can actually do that. You can get all the appointments that are upcoming. Like I know you may have inpatient visits that are upcoming or booked. So you'll be able to get all that in one single page. Now, maybe just to go straight to the inpatient pre-auth process. The first process is, of course, searching the member. So you will allow me to use a test member and a test insurance for that case. So I'm using test customer 13, that's our insurance. And the member number is Limo BP00. So let's search the member. So once you've confirmed that this is the member that you're actually looking for, you proceed to creating the visit. Yeah. On the visit details, you're able to get all the previous visits this member has had on that facility. And you may choose to use an existing visit or create a new visit altogether. The new visit will ask you to select whether it's an IP pre-auth visit or an outpatient visit. So for this case, I'll choose to go with the IP. So here, you'll be asked to enter the admission date, the visit end date, or when that member will be discharged. And the doctor who is actually admitting the patient, or if it's a consultant, you also can select that. So for this case, let me just use just a sample, Kericho, yeah. But I'll not go to actually capturing the same, maybe, because we already have a visit here that I wanted to just showcase. Just a moment. You're able to actually capture a new visit, enter the admission date, which is today, the discharge date, let's say it's on 25th, enter the resident doctor, say Dr. Fred, and save that visit. Yeah. After saving that visit, now you'll be able to add the diagnosis of that patient or any other details, if it's the chief complaint, the medical history, the medication, the allergies that the patient has presented with, and all that. After adding the diagnosis and doctor notes, you'll be able to proceed now to create a pre-auth. Yeah. And on the pre-auth, it will request you to select a benefit and what the item that you actually requesting to be approved for. For example, general hospitalization, or you wanted to do a surgery to this patient, or an optical inpatient procedure or something, or even a specialist. So once you've captured the pre-auth details, you will now be able to admit the patient. Yeah, let me just use a case that So you are admitting this patient to say wing A, room number 5, and bed number 2. Yeah, proceed and save. Once you've admitted the patient, now the patient can receive the services throughout the visit in the hospital. And if you need to add another, if the bill is has not surpassed the limit that the insurance has approved, then you able to proceed to do a discharge on that patient. You can do a standard discharge or a referral. A referral, you select the provider and enter the date that you booking that patient to the referring hospital. Apart from that, you will be able to view, just a moment, let me just select one active visit for me to view the details. Yeah, you can view the pre-auth here. And with this, you're able to view all the items that are related to that visit. That's the pre-authorizations that have been done, how much has been approved, the date of admission, the discharge date, the bed type that this member has been admitted to, and the bed cost per night. You'll be able to request a discharge from this point, like if the patient has recovered and feeling okay to go home, so you'll be able to request a discharge from this point. Yeah, I think that's it.